first webinar we've had on holistic oral health, and I'm really excited about this personally because we know that the gut is really where health begins, and the oral health is really, the mouth is really the first part of the gut, really. So when you look at the whole body, medicine and dentistry and physical therapy all are connected. We're going to talk about, just really briefly, you can see this on the screen and look at this later on YouTube or Facebook, but this is our clinic updates for what's happening right now in person, what's virtual right now. So pretty much everything is either in person or virtual, with the exception of the myofascial release, which is postponed for right now. Everything else we are doing that's in person is still happening, including medical visits, osteopathic manipulation, and let's see, physical therapy, red light therapy, labs, of course, IV nutrition, and acupuncture. Here are the COVID updates for Maryland, Virginia, and DC. Basically, they're vaccinating everyone now age 65 and up in phase 1B or phase 1C. There is research being done on vaccines' effectiveness against viral variants in the UK and South Africa. So Moderna is definitely doing that research right now. So we'll continue to announce that as it comes out. And then research from Rockefeller University in New York City shows that the memory B cell response to the virus lasts for at least 6 months. So that's a good thing. Here's the upcoming schedule in February coming up. We have yoga and sound healing with Shannon and Jade next week. We have Rebecca Wong for traditional Chinese medicine, no relation to me, but she's a herbalist and acupuncturist there talking about TCM, February 11th. And then February 18th, we have Dr. Carrie Jones talking about hormones. So that is coming up in February. And then we also, just to remind you, we have a HeartMath virtual visit that is built to insurance that we are going to be talking about de-stressing the nervous system with Liz Reese, who's a HeartMath instructor. And those have been really great visits. So Manny and Kim, you're welcome to come to that if you'd like. It's 4 p.m. on Tuesday, February 9th is when that starts if you're interested. So without further ado, and I'll just say, maybe hand it over first to maybe to Dr. Baer.
Hi, I'm Kimberly Baer. I'm a dentist in North Bethesda, Maryland, and we're more of a functional medicine type practice. And basically, we believe that we don't just treat the mouth, we look at what we do in the mouth, how it affects other areas of your body, and specifically systemically and structurally. It's huge. Every time we do work on a patient, it affects a whole triad of things. There's so many things we could talk about as far as like things we do differently is one thing is material wise, we're very aware of people's sensitivity issues. So all the materials in the office we have are usually the least reactive dental materials, everything from cements, everything we use. And we also have the capability to test patients to find out which materials would work best for them. And another area that we're very passionate about, Dr. Kim and I, is the structural aspect of when I go into a patient's mouth and I work on them, what that does to other systems in their body. For instance, I brought Manny into my office about 5 years ago. I had an incident where that's more than 5 years ago. I'm almost 50. So I was 40. So I like saying 5, but I just started running. It was a bucket list thing. And I got into the Boston Marathon, and maybe 6 weeks before the marathon, my knee was done. I saw a surgeon. They were like, no more running for a year or it's going to be surgery. And someone referred me to a colleague of Manny's, Louise Kelly, and they sort of do a lot of the same things. And she brought me in her office and did a full exam and was like, why is this going on with your knee? And took some sticks and taped them together. She's like, you're skeletally off kilter. It's like the top of the zipper, you're off, you're torqued here. So it's translating down to your left knee. if we could balance you here, it would take the pressure off your knee. And we took some bite sticks and found the distance that got me balanced. And then, I had these sticks in my mouth. I could stand up and my knee didn't hurt. It was amazing. It was amazing because it was killing me before that. So we taped them together. I went to my office the next day. I took my night guard and I opened it up to the same distance on that side, about 3 millimeters. So it opened me up 3 millimeters. And when I had that in, my knee was fine. So
Wow.
needless to say, I ran that marathon. Well, that was a long time ago. I ran that marathon 6 weeks later. I trained with the splint and then I fixed my bite permanently. I ran that marathon and I've been running them every year since. And I have no issues with that knee. So anyways, that happened. And I was like, oh, this is crazy because we change this all the time with every little filling and thing we do. And then I have no idea if I'm hurting something or helping something. So I asked Manny and Louise to come into the office and I was like, I don't know how I'm going to integrate this. I just want you to look at my patients. I don't want to chart. I just want you to look at my patients and tell me what I need to do to help them or at least not hurt them. And then that just sort of took off. Everything from having Manny take a look and see what I could do if I'm doing like a lot of restorative work. And then that really translated into one of the biggest areas in our practice, which is the growth appliance and the sleep issues and, the things that comes with. We are big believers in a lot of our issues, especially, our skulls are too small. We're getting smaller and smaller here, and our airways. So what we found is that we can stimulate growth, even on adults at any age, up to about 5 to 6 millimeters a year, and open this up around C1 area, C2.
Wow.
So
That's so huge.
no, it's crazy. And it's
Yeah.
crazy. But once again, I can only look at this. Uh, and that's why we have Dr. Kim in the office and he can kind of translate like what that's
Can,
doing.
can I just, I'm going to interject. This is a great intro, Dr. Baer or Kim. When you look at the traditional medicine, traditional dentistry, there's not a lot of interplay between the two, but we know that this simple yet revolutionary concept of the body is connected, right? The mouth is connected to the rest of the body, the myofascial, tissues, like you said, like fixing your jaw helped you run marathons every year, got you out of knee pain, and you're running every year. So this is something we also see commonly in our practice, like, one part of the body gets better, so then the rest gets better, that kind of thing. How did you, first of all, how did you come to a more holistic approach in dentistry? How did you kind of get to that yourself?
I, my, my daughter was born, she's 12 now, actually almost 13. She had really bad asthma as a baby and I
Mhm,
was just crazy, didn't want her living on steroids.
mhm,
And I did some research and a colleague of mine told me about ozone therapy.
mhm.
And that's what
Yeah.
really, so then I went and I did my training in New Jersey with the guy who trains everybody in the US. And then he was like, oh, we have a master's program in toxicology. And then I started learning, it just like blew up.
Yeah. Yeah.
And
Start going down that. Yeah.
it's so
Yeah.
crazy when you realize there's nothing you can put in your body that isn't going to affect things. So even little things that I do, and yeah, no, I think it's insane that people don't know. Like even people with high, I have patients who have had terrible infections, terrible jaw infections, had no idea they even had them. They're on high blood pressure meds, they're on a ton of meds. We
Hmm.
clear out those infections. I can't tell you how many of them end up being over medicated, like have to get off their blood pressure meds.
It's gut inflammation, and we know that oral health is related to heart disease, obviously, to vascular inflammation. So you're basically curing that oral infection, which then is going to lead to less vascular inflammation because there's no what I call leaky mouth, right? It's like this idea
Yeah.
of leaky gums, right? And so There's a lot of questions that are rolling in now, so I'm going to actually, if you don't mind. So we do want to hit a couple of things. I think let's start with the question. We're just kind of taking them in order about sleep apnea. So we have a 56-year-old woman with obstructive sleep apnea. So basically, where people are either snoring or can't breathe that well at night, and that can lead to fatigue and a lot of other issues. We know about there's an increased risk of heart disease, stroke, and dementia, even with sleep apnea. Um, the CPAP, she said that the CPAP doesn't work for her. She's 56. She wants to know about the oral device that is used to prevent sleep apnea. How much does it cost? Does the insurance cover it? What if it doesn't work out? Is it painful to wear? I also clench during sleep. Mouth guards do not prevent clenching.
Yes. Well, people clench because when you clench, their bones move, you get more air. So it's sort of goes hand in hand. Someone with sleep apnea is always going to clench. The appliance, there's several appliances, depending on if you just want an appliance that's going to get you more air at night. The price range on those are like probably start at around 2,000. If you want to actually solve the problem and expand your jaw and open your airway up, then you're looking at something closer to 8,000. The appliances, you can get coverage for them. Usually you have to have had a diagnosis, your doctor, you have to have an official diagnosis, and you have to have tried the sleep apnea appliance. And then if the CPAP isn't working for you, your doctor writes a letter, and then you can usually get coverage from your medical insurance for the dental appliance. But most people's dental insurance will not cover it.
So if there's a diagnosis of sleep apnea, they try the CPAP, it's not working, then they can apply for the medical insurance to cover the
Yes.
dental device.
Yeah, they just need a letter from their medical doctor stating
Okay.
that. Yeah.
I'll be happy to write any of our patients, just to FYI. It's so important. One thing we see a lot in our clinic, as you probably know, Kim, is we see people with chronic fatigue or gut issues or, so many other issues. And one of the big immune issues, and one of the big things is sleep. Of course, that's, I think, one of the most important, if not the most important lifestyle factor is sleep. If someone's sleep is good, then their health will likely be much better. And conversely, if it's not that good, then it'll affect all other systems and make it that much harder to heal. So thank you for that. I have a question about clenching. So you said that clenching means that there's hypoxia going on, essentially, that there's low oxygen. Is that the case with all clenchers or just people with sleep apnea?
Most clenchers clench for that reason, yes. And
Or
it's also
low?
not just you get more air, the base of your skull, you get more air, but
Yeah.
it also redistributes like fluids, and people do it at night when they're sleeping. And there's some great research Japan did in the 80s. And it really shows how certain people at certain hours of the night would clench more. It's a very effective way for your body to redistribute blood flow and focus on different areas.
So even if someone is clenching normal, like if someone is clenching but doesn't have sleep apnea, does that mean that they need to get more oxygen somehow, even if they don't have sleep apnea?
Well, it relaxes you.
Mm-hmm.
So it activates your parasympathetic. It stimulates the roof of your mouth.
Oh, okay. Okay.
So you might not have sleep apnea, but your body's using it to calm or soothe. That's why you'll do it when you're focusing or concentrating to increase
Got it.
blood flow to
Okay.
your
And
brain.
then of course the sinus issues too. Some people they might be not getting enough oxygen because the sinuses are off, and then they need
Yeah,
to
yeah,
open
that's a
up that
big one.
pathway. Okay, another question, another big topic that definitely wanted to cover today from email. For silver amalgam fillings, are silver amalgam fillings toxic? First of all, I think that the majority of that amalgam is probably mercury, so I'm sure Dr. Baer will talk about that. If yes, if the amalgams are toxic, what are the ways to mitigate this? This person, as she says, he or she says, I have one from the late 1960s, 1970s. I wanted to remove it, but I was told it would cost $2,000 to remove. My dental insurance doesn't cover this cost. My insurance would cover a normal replacement, but does that dump stuff into my body? First of all, does dental insurance cover amalgam fillings or no?
Yes. I
Yes.
mean,
Okay. Okay.
they don't see it as if you've had a filling in your mouth for longer than 10 years, they should cover the replacement of it.
Mm-hmm.
How much they cover, it just depends on your insurance, but
And,
they
and,
don't.
and what do you think about this silver versus mercury amalgam? Is it
It's,
toxic?
it's,
What do you
it's
think
like
about amalgams?
they're like 55% mercury, very
Okay.
little silver. um,
Yeah.
but so I mean, if mercury is very toxic, so if
Yeah.
you got something in your mouth that's 55% mercury, then it's, you know, it's going to be, how bad it is for you, I guess, would vary person to person. But I can tell you this much: it's definitely not good for you. It's
So,
not
so why,
healthy
why were
to,
they called silver? Because it's mostly mercury. Why did whoever is
because that
making it
sounds
realize
better. That sounds
it
better.
sounds bad, right? No one's going to buy a mercury amalgam filling, right? No one's going to actually
Yeah.
buy mercury. Yeah.
Yeah. Oh, and
But,
then removing it, it just has to be done carefully.
mm-hmm.
Um, if it's done with the right precautions, like if you look at the IAOMT website,
Yeah.
um, there should be little to no exposure. Uh, so, I mean, keeping it is just a constant, slow exposure. Um, so if you've had it that long, even if that thing was made out of diamonds, it needs to go. You know, it's causing, probably there might be decay or other issues underneath of that. You're just not going to know. It should be removed.
There's diamond fillings, really?
You know, I'm saying, even if there was
Oh,
no mercury in it,
okay, okay.
you know, something like that should.
Right, because the decay might lead to more like infections,
Yeah.
oral infections. Okay. So what's the difference between, say, a traditional dentist and one that's more holistically trained like you in terms of how to safely remove those amalgams?
So we do it in a way that you don't want to just go in there and start drilling on them. It vaporizes and goes everywhere. So we have a lot of extra equipment, and there's a technique we use to remove them, so we don't even have to drill on them. For the patient, it's no different. It doesn't take any more time. It's not painful, but we have a lot of extra equipment and little techniques and specific instruments we use to remove it, so that we're not allowing any off gassing.
Mm-hmm. Great. Yeah, and are most dentists, regular dentists, are they using mercury still in the fillings, or what's kind of going on right now in 2021?
Most dentists are not anymore, but you'll see it a lot with like an HMO practice,
Okay.
because that's what they will reimburse for.
Right.
It's the
Okay.
cheapest material.
Okay. Let's see, just going down the questions here. Swati was asking, hey Swati, would you be able to help with clenching and sleep apnea? I think you kind of talked about that, but does your practice see people with sleep apnea and
Oh
clenching?
yeah, yeah, yeah. That's me. You described me. Yes, yes, yes.
Yeah, yeah. Okay, so, and then the therapy for asthma, what you said was ozone therapy for your daughter, I think?
Yes. Um, for her, what we did was I had a medical grade ozone generator in the office, which we use for all of our dental procedures. And I
Okay.
would literally, every day you make ozone, and you can ozonate water,
Mm-hmm.
which is awesome. But it only lasts, the ozone's only good in the water for about 8 hours max. And after that, it's just plain water. So I would make some ozone water before I left work, and I would bring it home. And my daughter was a baby. And first of all, we got rid of all cleaning products. And so I would bring it home, and we had water bottles, and that was what we used to clean everything. And then I would take the ozone water and put it in her nebulizer. And that's what we used.
So ozone is a way, how does it work for asthma? Ozone kind of helps
It,
to reduce
it, it, it
oxidative
eats up,
stress?
it eats up inflammation.
Got it.
Yeah,
Yeah, I'll
it
have
was
to
very
check that out.
effective.
That's great. What are your thoughts on the ALF, oral mouthpiece? First of all, if you could describe what the abbreviation stands for. What are your thoughts on ALF and cranial support?
Awesome. It's great. It
What,
really
what, is,
allows,
what does ALF stand for?
it's advanced light wire
Functional appliance.
functional appliance. It's like a mouthful. It's a light wire appliance, and it's very small, and it's stimulates the sutures for growth, and it doesn't interfere. It doesn't lock you down, so it allows the bones to actually, if you rotate and move. Um, where they want to go, and they're not being forced. There's no,
Oh, okay. Oh, well, that's nice.
it's considered a passive appliance.
Yeah, instead of like forcing the teeth to go somewhere.
Yes, and
Mhm.
you're just stimulating bone growth. So it's very patients always describe, it feels good. It's very relaxing. You don't have any control what happens sort of with the teeth, but you do get that movement, that expansion. So sometimes afterwards, you will need to do either orthodontics or, you know, some Invisalign.
Mm-hmm.
But
I don't know if Manny wants to share his slides, or if you want to share your slide now, I can share that, Kim.
Sure, I'll show mine, and then
Okay.
I just have this one. This is an adult.
Let me share my screen back here. Share screen. Okay, you can kind of see the screen a little bit.
So this is a patient that did a DNA appliance. This just shows you the roof of our mouth. When you see the really, the narrow one, that's usually what you see with, you know, very often with a sleep apnea patient. Vaulted ceiling, the roof of our mouth is actually in her sinus cavity. So we bring it down, which allows more nose breathing, air in the nasal breathing. So, but it shows you how her jaw as an adult, what we can get done.
That's pretty impressive. As an adult, you can actually widen you're really giving people more oxygen throughout their life when that happens. Basically.
Yeah.
That's so incredible. And it looks like she might need a mercury amalgam removed.
Yeah, she's now my patient.
Okay. That's funny. Thanks. All right, so we can go to Manny, Dr. Kim here. Welcome, Manny.
Hi, everyone. Thank you so much for having me here. My name is Dr. Manny Kim. I'm an integrative physical therapist. I'm from Chicago, went to Northwestern. I started this journey from the get-go, always drawn to more of a holistic perspective and methodology. So let me go ahead and share my slide, and I can just talk more about what I do. Is this on, Andy, on share screen?
Not yet. You can share from your computer though.
Okay, like right now?
I don't see it yet.
Oh, all right. Let me see. Can you see that?
No,
it's not there. You'll have. Are you pressing share screen?
Let me see. Hold on. Okay, I see it now. All right. Share. Okay. All right. Can you see that?
Yes.
Okay. Very good.
There we go.
Let me go up. So what I do is sorry, let me get this blown up here. It's more integrative physical therapy. So I'm looking at the whole body, not just one region. And even if someone comes to me with a complaint, say for a shoulder, I'll look at their neck anyway, their hip, because it's all related. And I'll do some tests to prove it to them, to show them how it's related there. The other distinctive would be, I'm looking at multiple systems. So what I mean by that is, I don't want to focus only on the musculoskeletal system, not only muscles. You have to look at the nervous system. You have to look at the autonomic nervous system in particular for many people. And you have to look at their vascular system, their ligamentous system, so on and so on, even their gut. So there are ways to determine if that's involved with what they're coming for. Inflammation is a big theme, what I do. So everything that I'm addressing, there's always a precursor of inflammation that most likely precedes pain. So there's something going on that's not right. And there's a chemical irritant in the nerve receptors in the body. And lastly, the airway, that's a big deal. I screen everyone for airway issues. And I'm always looking at people's mouths. And it's so common that I just want to spread the word and let people know that, you know, it does affect your sleep. It's a very common issue that many people snore and have apnea, and even what we call upper airway resistance, which is a milder form of apnea. But it really does do damage to multiple systems of the body and through the lifetime. So the earlier you detect it, the better it is for you to find a solution. So here's an example of someone who has, I call cranial distortion. And if you start looking for this, you'll probably notice this more in people. But there's clearly a difference here with one orbit. You can see the eye on one side's higher. And it just shows you that there's subtle motion in the cranium that it can evolve this way, or you can have trauma that can also address that. Here's another example where this woman's bite line or cant is off. So what's going on there? And that obviously affects her bite, but it does more into the body also. So studying the head and the face is a key piece of my practice, because I feel the key is to interpret, what does this mean for us? How does it affect the body? What I do, I use a couple very unique methods to interpret the body and the system perspective. Cranial dysfunction does have a direct impact on the vascular system of the head. And that's sort of what I discover with a lot of patients that have what we call distortion. The spine also negatively impacts the vascular system, the neurovascular system in particular. And the other thing that's unique is that each cranial bone has a specific impact on your body. And the last part is that you want more symmetry. Symmetry is good for the body, but also for the face and the head. And that's part of what Dr. Baer is also helping to improve when she uses these growth appliances, is we're establishing greater symmetry in the cranium, in the face. This slide is just showing the connection between our bite and our spine. And it's one other reason why I'm working with Dr. Baer, is because I need her expertise. I'm looking at someone's bite and I'm saying, okay, this bite is off on one side. They might have dysfunction in the neck. It's causing their whole center of mass to shift to one side. And if this is the case, then we need a dentist's help to sort of reestablish this connection here. What do I mean by multiple systems? Well, here's an example. Arteries, the cartilage, the organs, the nervous system. I want to bring your attention to the nervous system, in particular, the sympathetic nervous system. Is a big issue for many patients. Many patients are in fight-flight mode. And I find this a lot. And the key I've noticed is what's driving this. There can be multiple factors, but if you have sleep apnea, if you're clenching, I guarantee that there's sympathetic dystrophy or a drive that is contributing to manifestation of nerve tension in the neck or in the body and dysregulation of that system. This is just an example of what I do. I use diagnostic tender points, and these have been mapped out. The technique I use is called counterstrain. And we have diagnostic points. For example, these green points here in the body represent venous dysfunction, venous or lymphatic. And so this also applies in the head, which I don't have a picture of, but it will tell me, is this a muscular issue? What's going on here? Is there a nerve issue or is there a vein issue? If I find someone that has loads of venous points in the body, then it's very indicative of venous dysfunction and or lymphatic dysfunction. Common, very classic picture of trigger points in the masseter muscle, but I just want to expand your awareness of thinking about other anatomy in the jaw and the face. We have to consider the bones. Like I said previously, each bone has an impact on the body. Some of the things that you can relate to bone dysfunction would be obviously scoliosis. You have curves, asymmetry of the face. You can have rib dysfunction where the ribs are literally torqued and twisted. That can contribute to scoliosis. The bone dysfunction can contribute to nerve compression. Here's another key word that I'd like to just share with you is central sensitization. And that is a issue that you definitely want to diagnose and have someone diagnose for you, because these are the kind of patients that have a lot going on in their body. They don't know what's driving it. They can have a whole quadrant in their body just in a complete mess, or even one side of their body. They're often inflamed everywhere, tender to touch, and very sensitive. So if that's the case, then we have to really deal with what's causing this in the first place. You know, one example I can think of right now would be if you've had, say, a concussion in your history or any kind of trauma. So PTSD can do that too. But knowing if this is a central issue will really help solve the underlying problem. What is the root issue of someone's pain at their elbow? Is it really at the elbow, or is it being driven by the neck or the cranium? And ANS is the autonomic nervous system. So that is another big takeaway that I'd like to share, that we really need to address the system, because a lot of people are not in balance with their autonomic nervous system, which is that fight, flight versus rest, digest. I'm not sure, have you discussed that at all, Dr. Wong, about the autonomic nervous system?
Yeah, we haven't. I think we've had different webinars on that. I think our patients are pretty, can you put in the chat if you are have done the vital scan here or anything? We have them test here, look at autonomic testing.
Oh, nice. Yeah.
So we do that here quite a bit.
Yeah.
But yes, I mean, it's certainly something that I think, bears worth repeating and emphasizing over and over, because we know that that drives a lot of issues, really.
Yes, absolutely.
Yeah,
So,
I think we just looks like we have. I know there's some questions too, but after you present, then we'll do some. We'll open it up for Q&A.
Sure. So some other things that you want to think about regarding this region here. We want to know if there's dysfunction in the maxillary artery that supplies blood flow to this area. Facial vein, the lymphatics for the submandibular area, the plexus, that's the venous plexus in the jaw. How would I know if these are things that we need to address? Well, we have diagnostic points in the body that tell us. It's very useful.
So you press it, or how do you clinically assess that?
Yeah. So going back to that slide where I had like this, these tender points, they're very diagnostic. So it's very distinctive. When you have a tender point here, what happens is there's like a little nodule and it's tender to touch and the area is rigid or so.
Okay.
So if I were to check on someone's face, it's very palpable. Often it could be mistaken for just muscle tightness, but it's very, it's mapped out in a way that everyone will have, say, venous dysfunction at this spot in the lower jaw. Okay, so it's just part of the diagnostic process that helps me understand what's going on with this patient. Do they have, say, trigeminal nerve issues in the jaw? Do they have a venous issue in the body? Are there lymphatics crying for help or something?
Yeah, great.
So, and that's just a picture of the venous plexus in the jaw. And I find this a lot in patients. Now, here are some examples of people that have venous lymphatic dysfunction. Okay, they'll often have pressure headaches, brain fog. Oftentimes there'll be a history of a concussion. You can have nerve symptoms. Sinusitis, it's a big issue. Tinnitus, some people can have fatigue from that. And oftentimes when this is the case, sometimes what happens is someone's sinusitis can be resolved by draining their neck, literally the veins, the internal jugular vein, or going through the jugular foramen to depressurize the head. And so that could be the case. So really going down that road and figuring out why are their sinuses inflamed is a good thing to address if that's an issue related to breathing. So this is just a picture of the arteries. They're very important for anyone receiving dental work. You want to have good blood flow, but often people with certain migraines have arterial issues from the cervical spine. So burning sensation often is related to arterial dysfunction. Someone will come to me and say, it feels like it's burning right here, Dr. Kim, and I don't know what it is. And if the tender point is related to an artery, then that can often resolve it. Here's just a picture of the trigeminal nerve, which is a very important structure to address with anyone that has dysfunction in this cranial facial area. But did you know that, the trigeminal nerve has sympathetic and parasympathetic fibers that piggyback along it. So it also controls blood supply. The venous sinus membrane is the plumbing of the brain or so. So it does have an effect on that system. And so that's very important to address, because you can have people that may have a really hard head. Nothing's moving. Everything's tight here. They could have had a concussion perhaps, but it makes it very difficult to expand with an appliance when you have a pressurized head. So that's something that I look for And we definitely want to address if someone is a candidate for an appliance, but they may need some prep work. Just say, we want to make this successful. Let's get things moving better.
Yeah.
Let's open you up. And that the tooth really is another way to affect your autonomic nervous system. So if you have dysfunction, it is playing a role in the sympathetic or parasympathetic through the trigeminal nerve complexes there too. Okay. So, and here's just another sample list of things related to neural dysfunction, PTSD, anxiety, any kind of neuralgias. Oftentimes the muscle's really rigid, very tight. Oftentimes the nerve, it can be a driver itself. So, okay, so this is just a summary of things that I look for in terms of what I do for integrative physical therapy. This first takeaway, the central sensitization, is really key. And it will help a lot of people to know what they're dealing with. Is it a central issue or is it a local issue? Is it an inflammatory issue or is it purely orthopedic? Those are some crossover there. Is there an airway issue? A lot of people I see, they have poor posture, but it could be their compensatory breathing. They might be mouth breathing and sticking their head out and also having some apnea at night. And if that happens over time, they will have postural adaptation. So if that's a driver, then often the solution is to improve the airway to help fix them, so to speak.
Can you email me this, Manny? This is a great slide.
Sure. Yeah. You like that? Good.
It's like beautifully laid out. It's amazing.
Thank you. Thank you.
Yeah.
But I really want to impart this understanding that you have to really look at all the systems. They matter. And there are people out there that can help you understand what's going on. There could be multiple layers to the onion, but addressing inflammation, addressing the autonomic nervous system, addressing the airway, those are key pieces, I feel, for many people to help restore their health and their function and quality of life, for example. So I think that's a good place to stop.
No, this is great. This is great. Thank you both for Dr. Kim and Dr. Baer. We have a lot of questions, I think, from this. I'm going to start with the logistical. This is a great presentation. Logistical questions. First for Dr. Baer, what is the COVID protocol in the office? Do you have, I think, air filters and different things? I think someone said, is there a negative gravity machine? I'm not sure about that, but what is the COVID protocols in your office?
Well, we have a lot of ozone in the office. We have just tons of air filters, medical grade air filters, and UV light sanitizers everywhere. I mean, we were overboard to begin with. We were COVID good before COVID. So when COVID hit, it was actually pretty funny because we have so much filtration going on. Office colleagues that poo-pooed what we did for many years were calling and asking, what are you doing? We brought it up another notch for COVID. We're vaccinated now, but yeah, for our patients, we're very, very, we just, it couldn't get any cleaner in here.
Yeah, no, and I was just in there this morning. Dr. Baer's patients, just full disclosure. I just wanted to say personally, it's kind of funny because I'm on this metagenics detox right now, so I'm eating very cleanly, etc. And the dental hygienist today was like, your gums look less inflamed. So like, there's clearly an connection between nutrition and gum inflammation, or nutrition and gum inflammation. What are your general guidelines for nutrition in general, and oral health?
I mean, very basically, it's one of the biggest things is most people are walking around chronically dehydrated. You see it all the time. Yeah, increase your water, especially in the winter. And then it's not nutrition so much, but we're very aware of what mouth breathing does to your GI and your gums and your mouth. So that's another thing we treat. But definitely a low inflammatory diet. I've seen patients who we just have struggled to get their periodontal disease under control with all the ozone and all the extras, but it really wasn't until the diet changed. And then, and usually when you see, for instance, a lot of decay, especially like in between the teeth. You'll see it. We see it very often with 20 somethings. It's usually what you're drinking. It lowers the pH in your mouth, and it just decay will be.
So you want a more, are you a believer in the acid alkaline balance there? Like
Yes, I'm all about that.
You know,
And so people think, oh, it's juice. No, no more juice.
so that's acid, basically. That's kind of
acid. It's acid. Yeah.
Great. Any advice on oral probiotics is a question from Holly.
Oral probiotics. I mean, I think some people can use extra, but I really believe your body is designed. I mean, think if you're eating right, I don't know that you need if you're eating right and you're living a healthy lifestyle, your body is designed to balance things out in your mouth. So we don't do a lot with that. I'm more about like fixing the problem. The gut, if you're breathing through your mouth, your gut, you're going to have all kinds of acid reflux. You're going to have all kinds of issues. And it's more about not getting that nitric oxide through the nose.
Trying to avoid mouth breathing because we know that mouth breathing also changes the pH of the mouth, and it can lead to, problems there. So a lot of the good bacteria in the body will die if the mouth is open.
If you use an over-the-counter mouthwash, it destroys the bacteria in your mouth. And like literally that affects your gut. Like
now the one you have there, the dental herbal one, does that not affect?
No, it's fine. It's mostly just essential oils.
Okay.
You do not want anything that strips your mouth. People
no Listerine. No Listerine. It doesn't.
No. I mean, anything that burns a little, it's not good. So we think that's good, but it's not good. It's not good. Right. Actually, you could use water with a little bit of salt.
Okay.
And that would be perfect.
That would be good. Nice. Okay. Okay. We'll get to the insurance question. Does your office take insurance? I guess both for Dr. Kim and Dr. Baer.
We will file it for you. We are not providers, but we will file it and wait for reimbursement.
Yeah, I'm an out-of-network provider, so I provide a super bill receipt with all the insurance code for physical therapy.
By the way, they're amazing. Dr. Kim and Dr. Baer are amazing. So if you go to them, it's well worth it. Your health investment. Just to say, and actually, Manny, I'm happy to see you also. Good to see you. Now, at the talk about this here, I'm like, I need to get my facial structure and evaluated. It's always good to kind of help that, and in terms of the health, just figuring out also the diameter of the mouth, right? I think this is the idea that in a modern society with chronic stress and inflammatory diet, a lot of times over the generations, our mouth size gets smaller, right? So that's the idea of this Weston-Ace Price diet, or this idea of basically a more natural living, and then we can maybe get back to that. It's pretty cool. Okay, Bobby says, is it necessary to replace a night guard after a number of years if it still seems to fit okay?
I mean, there's no, if it works, no, there's no number on that. I've had guards that I had for years. I always have my favorite one. My dog's always like destroyed at some point, their hands on it, paws on it. But yeah, no, I'd have to see it, but if it's working for you,
there's no hole in it, basically.
Yeah. If you haven't eaten it yet.
Back to the clenching. Swati asked, what if clenching is due to stress? How can you help? I think that's where the autonomics come in, and certainly
I can take a shot at that. Yeah, there's different forms, origins for clenching. The sleep disorder breathing is very, very common, but not the only reason why people clench. And there are people that, if you have a history of PTSD or concussion, that can definitely contribute. People can have nightmares and things. So you definitely want to take all that into account. But I would particularly want to know, what's the state of their autonomic nervous system? Right. If they're running on, say, 4,000 RPM, then it will manifest in the body. And
that's fast, right? 4,000 is fast.
It's very high. Yeah, you want to be at 1,000 RPM, like in the car. So you don't want to be revving too high all the time, because you'll probably have adrenal fatigue later.
Right.
But the daytime clenching and nighttime clenching is actually different. The neurology is different. So we want to distinguish the two and help both if you have both. So If you go to the right provider, then they could help sort of tease out, well, which is it? Or it could
Yes,
be
that's a good point. At daytime versus nighttime clenching. Okay, great. Thank you, Manny.
Mhm.
What are modern fillings at traditional dentist offices composed of? Is there mercury in those? If you had, oh, I see. In other words, if you've had a filling in the past 5 to 8 years and it's not silver/mercury, what is the composition of that filling now?
Usually they're resin, they're plastic, and there's a very large between like a high quality, low quality resins, and then we use a material that's a porcelain based, looks like a resin, but it's porcelain. That right now we find is the best, but they're usually resin.
So resin, but you use porcelain, which are better, I guess. They're
Well, it's stronger.
stronger. Okay.
And
Maybe less
there's
toxic.
no BPA.
Are
Yeah,
they less?
yeah,
They
they're
would be.
more
Resin
compatible.
is basically a plastic, right?
With
So putting
plastic.
plastic in your. Okay.
Yeah, yeah.
Yeah. Okay. Thank you. And then okay. Karenina wrote, I have 3 root canals and an autoimmune disease. I have been advised to remove those teeth, the ones I guess with the root canal. However, I also have TMD. I'm not sure if that means
That's
TMD.
temporomandibular disorder.
Oh, okay, thank you.
Yeah.
TMD, and I am concerned that if those teeth are removed, then my bite and malocclusion will become worse. That might be yeah, that's a good question. Thank you.
Yes. No, I mean it's smart to think that, because you definitely she needs to be with somebody who's going to keep her balanced. So like Manny Kim here would be
Yeah,
perfect for that.
yeah, exactly.
But it sounds to me like she needs to get those guys out.
Right. That
Yeah.
plus the myofascial for the mouth,
Mhm.
or facial. Great. Okay, my dentist wants to paint. I don't know about this. Maybe you could answer this. Paint silver diamine fluoride on the teeth. How safe is that?
Okay, so that is it's the stuff that we use a lot when it's very big in third world countries. You paint it on their back teeth. It turns your teeth black, but it makes them very hard.
So they won't fall out.
Yeah, so you don't get decay.
Okay.
I do not think in this country that I think that care is pretty available. As far as I can't comment on how bad that is, and if there's fluoride in it. I mean,
Let's talk about fluoride, because I know we want to get to that. What's your view of fluoride and, in general?
it's toxic. I mean, if you were just getting it when you went to the dental office, that would be one thing, but we are all getting way too much in the water. I mean, we see it with white spots on the teeth.
Oh, wow.
There's some great research NIH did like 20 years ago on lowering, like putting it in the water lowers kids' IQs.
Okay. So this is actually for a 3-year-old. So we probably want to avoid that for a 3-year-old then,
I mean, I would do everything I could for them not to get decay. I don't know that I would.
And by the way, just FYI, this is not official medical or dental advice. This is not.
Yeah.
But yeah, I mean, in general, we know that fluoride also promotes calcification of the pineal gland. And we know the pineal gland secretes melatonin, which is one of the primary antioxidant, anti-inflammatory hormones that we have. And of course, we need melatonin to promote sleep onset as well. So I think if we know that fluoride promotes pineal gland calcification, and that we know that pineal gland is important for melatonin, then fluoride probably is going to deplete melatonin indirectly. So that's another piece there. Yeah, so that probably is. Can you speak to how traditional orthodontics impacts reduced airway size? I'm not sure. Does that question make sense?
Yeah. Traditional, well, they're about retraction and pulling in heavy loads on the wires. And Manny can talk more about what that does to the bones as far as like limiting their movement. And he's worked with lots of patients who have had issues. Do you want to talk about that? He was actually just telling me about this.
Yeah, so a lot of people that have a history of orthodontic work, what it does, it can induce strain on the cranium and the bones in particular. And it can also promote underdevelopment where the expansion is not allowed to happen, especially depending on the child's age.
Yeah.
But yeah, it really does promote more stress on the system, so to speak.
Can you work with that child that has the braces or other things? Is that something you'd work
Yeah,
with?
you can. Yeah, you can work it in any phase there, but a lot of it is understanding what's going on with the
Yeah.
person. And this is also a key piece
Yeah.
in helping someone's cranium and development here.
The nasal passage. So in
Yeah,
a way, ALF might be another possible choice instead of
yeah,
orthodontics, right?
yeah.
Okay.
But the thing that I tell my patients is with any appliance that you insert here, it could be an ALF, it could be a flat plane, it could be anything. You want to maintain patency here.
Hmm.
There's an assumption, because if you don't, then it sort of alters the benefit of the appliance itself.
Got it.
So,
Okay.
so we're getting back to this again, and see this link here with the
You mean
airway.
getting back to keeping the
Yes,
patent, everything. Okay.
absolutely. Yeah, absolutely.
Got it.
So
Okay. Christine asks, what products do you recommend for oral health? What are your favorite toothpastes, toothbrushes, floss, etc.? I don't know if you want to, we can put more in there for everyone, but tooth whiteners, stuff like that.
Tooth whiteners. I mean, that's I don't
Probably
have
a no, right? Would you
favorite.
recommend tooth whiteners or no?
Some are better than others. It's not horrible to use something with a little peroxide in it. It just depends. That's very broad. But I do like you can go on Amazon and get like the Risewell products. They're vegan and they're really great.
They taste really good. Yeah.
Yeah, and tooth and gum tonic and Perio Clear is another good one. They there's water with a little bit of salt in it.
Mm-hmm.
But we do stay away from fluoride.
Stay away from fluoride. Yeah.
Fluoride,
Yeah. That makes sense. Yeah, we're already getting enough fluoride in a way. Okay, there's a bunch of let's see, I'm trying to find the questions here. So CIH patients, yeah, I mean, we will refer people to Dr. Kim and Dr. Baer, basically. There, we've talked more about that. Our, overall future there, plans. Let's see. Are there any issues with appliance use and osteoporosis in terms of how bones resuture? I think is the question.
No.
No.
The mouth doesn't get osteoporosis, which is a huge area of research.
Yeah.
So, no.
I have a clicking. I'm trying to get to now. There's a ton of questions. So, someone had Kathleen said she has a clicking in the right jaw when I open the mouth. Which one of you would I make an appointment with? Both.
I think both. Yeah.
Right.
I mean, it depends on the pathology, but what's useful in Kim's office is she has the appropriate imaging so we could see what's really going on in the condyle and the disc.
Yeah.
So you also, with any clicking, you want to know, what's the position of the temporal bone, because they could be asymmetrically positioned.
Got it.
That can also contribute to TMD or TMJ or so.
Yes, I know it's 1 o'clock. I know it's soon, but I still have a little bit of time. I don't know if you guys have a little bit of time, but
a few minutes.
Yeah, we can see a few minutes.
And for those of you who have to leave now, it's 1 o'clock. It's lunch hour. Thank you so much for attending. But if your question, I'm going to try to get these questions. They'll be available on YouTube and Facebook, so you can watch it later. So thank you all for attending. But we're going to continue for a little bit of questions here. Thank you these are great questions, by the way, and amazing answers. So thank you. And let me just look at, let's see, I'm a little lost now in the question, because, oh yeah, Heather says, this is so informative. Thank you. Yeah, I just want to thank you both personally too for coming on here, Manny and Kim.
Sure.
Heather says she suspected many of her issues have resulted from 2 root canals that have failed and now an implant that's failed. She has pain, swelling on the side of an implant, pain in the jaw joint, swelling on one side of the mouth and on the inside of the mouth. The muscles have deteriorated because she chewed on the other side for about a year. So I guess there was some atrophy on the other side. She's had some infections of the jaw. She needed rounds of antibiotics. She's been fighting an H. pylori gut infection. Sounds like a functional case, a lot of complexity going on there. She feels like it all stemmed from the implants. Do some people's bodies just reject the implants is your question?
Yes. I mean, Yes, there's a lot of different types of there's a big range. She sounds like she should have some biocompatibility testing done and
Mhm.
find out exactly which
You do
material.
that in your office, or?
Yeah, it's a blood test we send out to a lab, and it's great. And it basically tests you for every dental material that we use now in the
So
U.S.
essentially, is your immune system reacting? Is what that person has in their mouth causing inflammation to where the immune system is reacting and then causing that
Yes,
person's body
and
to?
and it's a nice roadmap to know what not to put in your mouth
Yeah,
moving
exactly.
forward,
You
because
can be
clearly
more
she's got a
precise.
lot going on.
Right.
Yeah.
Great. Do you ever do the oral DNA test? I know some people are telling me about that, where you're looking at
Yeah.
different bacteria and.
Yes, we can do that in the office.
Okay, great. Can combine that with the functional stool test that we do, and then we have the gut more covered anyway. Yeah, thank you, Mustafa, for your question. He's thanking you here for coming on too. Let me see. Yes, a lot of us went to see you for dental care, so your office may be getting. Do you see pediatrics? Do you see kids?
We do.
Yeah. Question about root canals. Karenina, can you just type that out again? I'm not sure if I thought we answered it, but if not, just type it out again. What mouthwash instead of Listerine is better?
Almost everything.
Everything.
You just want something mild and natural. You don't want something that's going to kill off.
The
all
one you
the-
guys have in the office, it's called Dental Herbal, I think, is really,
Mhm.
really good.
Yeah, it is good.
Really good.
There's
Yeah.
a bunch of them. I think you
Mhm.
listed them already.
Yeah. What is the best way to clean a night guard? Yeah.
That really depends on the material it's made out of.
Mhm.
That's also a pretty big range. I mean, we tell our patients to use soap and water, and then we also you can soak it in water with a little bit of vinegar for like 15 minutes. But never clean it with toothpaste. Just makes it white and crusty.
Don't clean it with toothpaste. Okay.
No.
All right. That's really the key thing, is to not. Yeah. Okay. Do you recommend oil pulling with turmeric for tooth whiteners? A question from Molly here.
I mean, sounds good. I don't know. I don't really know anything about turmeric whitening products. Like we're big on oil pulling.
Oil pulling, yeah.
And that does naturally whiten the tooth.
Got it. Oh, that's good to know. Okay.
Yeah, so we're about that, and then and you throw in a little of the MI paste, which is the calcium sulfate paste, is also whitening naturally. So yeah, those are really good, especially after you get a cleaning and the pores are open, and then you it's almost like moisturizer for the teeth.
Oh, nice. Okay, got it. Okay, if you clench at night due to stress and anxiety, what can you do to stop? This is always the.
That depends on the person and what they're doing. That's very broad.
Certainly breathing would be helpful. Always start with a deep breathing. Definitely myofascial release, that would make sense. Osteopathic manipulation. I know Dr.
I'd like to see their CT.
CT scan, yeah. Got it. There will be a recording, yes, available for this. Essential oils, so sometimes Tracy said she uses clove essential oil on the toothbrush and mouth guard, but it does burn. Is that bad that it burns?
Yeah.
Yeah. So
it's too strong. I've seen people with burns in their mouth from essential oils. I love essential oils. It shouldn't burn.
Yes, Karenina's question about the oral microbiome. So I believe Fusobacterium is one that's been associated with heart disease. Fusobacterium. So that is something that maybe looking at the oral health testing, the functional oral testing that you do is pretty good. I'm gonna have to talk to you more about that.
Okay.
Let's get more into it offline here. It's great. Let's see what else here. If I buy kids toothpaste, should it be fluoride free? I'm gonna try to answer that. I would say yes. It kind of makes sense, right? The kids are developing. You want that pineal gland to be open, and I know there's a lot of information about there about what's best for kids too. But what is your opinion, Dr. Baer?
Yeah, no fluoride.
There's no reason to have fluoride, right? Other toothpaste can also prevent cavities too.
Toothpaste is like, it's like when you it's like washing a car. it's more about the motion. It's about using the toothbrush and the motion. It's not, you could use salt water, you know, it's about the motion. It's not the toothpaste that's going to do the job.
That's great. That's great. Okay. More clenching questions. Is chronic night clenching bad for you?
Yes.
Yes. Okay. How do you recommend helping with tooth sensitivity if you recommend avoiding fluoride?
Usually the number one reason for sensitivity is clenching. So
Mhm.
that should be addressed. And then another awesome product to use in place of fluoride is the calcium sulfate paste, the MI paste.
Mhm.
That's amazing. So
Great. Joe, I put their website up there, Natural Dentist Associates. They're in North Bethesda, close to like near Rockville Pike and Old Georgetown Road. Yeah, very convenient. Yeah, yeah, I think Jen answered that too. Okay, let's see. Turmeric makes everything yellow. Yes, definitely. What kind of oil do you use for oil pulling?
we usually recommend coconut oil, but you can use like sunflower oil. There's other ones, but the coconut oil, if you like coconuts, it's awesome.
Yeah. All right. Well, yes, Dr. Kim and Dr. Baer, thank you so much for coming on today. I know that everyone had a great time talking with you. And if you want to know more about their practice, naturaldentistassociates.com, I think is your website.
Yep. Thank you so much.
Thank you.
Thank you. We'll talk to you soon.
Bye.
Bye.
See you all. Bye.